ID, and I'm Abby, Summer 2020 BSN1 Nursing Program. And so prior to starting this assessment, I washed my hands, and so with that, hi, my name's Abby, and I'll be your nurse for today. Can I have your name, please?
Brian Connor.
All right, Brian, what's your birthday?
9/20/2000.
Thank you. Okay, so today we're going to do your thorax and your abdomen assessment. If you have any medical issues or like pain in those areas.
I had an appendectomy and I've also had colitis.
Awesome, thank you. So looking at Bree on first inspection, she appears to be sitting in an upright position and relaxed, sitting a little bit forward, and she's breathing room air and is using her intercostals and her trapezius muscles to breathe. And so then looking at the posterior side of Bree, if you could turn towards the wall. So looking at the posterior side of Bree, she appears to have, her scapulas appear to be sitting flat, and her spine appears to be midline and straight to her body, and her ribs are sitting at a 45-degree angle. And so next we're going to check for her AP transverse ratio, and so to check for barrel chestedness. And so we're going to go like that. And so Bree's ratio appears to be 1 to 2, so she's not barrel chested. And then next we're going to check for chest expansion. So with Bree, so I'm going to go like that. And then Bree, if you could take a deep breath for me. Alrighty. And so Bree's ribs moved bilaterally at about 1.5 inches, so she has a good chest expansion. And so next we're going to check for her posterior lung sounds. And so Bree, take a deep breath whenever I move the stethoscope. Just start up here. Okay, good. Thank you, Bree. So Bree's lung sounds appear to be clear and not diminished. Her vesicular sounds and bronchiovesicular sounds were good, no wheezing or crackles or anything like that. And so next we're going to check the anterior side of Bree. So Bree, if you could turn towards me. Thank you. And so looking at the anterior side of Bree, her clavicles appear to be straight, not protruding, and then her sternum is also lies flat. And so we're going to check for breath sounds on the anterior side of Bree. Alrighty, so once again, Bree, if you could breathe when I move the stethoscope. And so we're going to start on top of the clavicle and not looking at, or not on top of clothes or bone. One more time. Alrighty then. side again. Okay, and so Bree's breath sounds on the anterior side are also clear. They're not diminished, no wheezing. And once again, her bronchiovesicular and vesicular sounds are clear. And yeah, no crackles or wheezing there. And so next we're going to do Bree's abdominal assessment. And so Bree, if you could lie on your back in the supine position. And it's important to protect patient privacy with this and making sure they have the proper drapings and coverings. Going to put one up top as well, and only having the area in view that we were planning on using. And so with that, there we go. And so with that, looking at the contour of Bree's abdomen, it appears to be slightly rounded but symmetrical, and her umbilicus also sits midline to her body. All four quadrants also appear to be symmetrical. Looking for any lesions. She has some primary lesions, which would be like few like moles and skin tags. Then on her umbilicus, as you can see, she has a secondary lesion due to a belly button piercing, and the color appears to be pale with a little bit of a red undertone. And so first, for the abdominal assessment, we're gonna auscultate and listen for sounds. And so we're gonna start, and also Bree, let me know if you have any pain in any of these areas. And so we're gonna start in the lower right quadrant first, and we're going to move in a clockwise position, and we're going to listen for any gurgling within like 15 to 30 seconds. So yeah. And also making sure to move it in 2 spots in each quadrant. Alrighty, so I heard some light gurgling in all 4 quadrants, and so Bree's bowel sounds appear to be normal active, which is good. And so also looking for pulsations, I don't see really any pulsations on Bree's abdomen as well. And so next we're gonna palpate, and so I'm gonna use 2 fingers, and then once again, Bree, let me know if you have any pain. And I'm also gonna watch the patient's face just in case she like grimaces and just doesn't like say if she has any pain. And so I'm gonna use 2 fingers, and I'm gonna press lightly twice in each quadrant and feel for any distension or tenderness. Alrighty, and so Bree, I didn't feel any distension, just softness, no tenderness, and you didn't report any pain. And so next we're gonna palpate Bree's bowel area. So I'm gonna feel for pubic bones and then go to the center. And so that feels a little distended and full, so bladder might be full. And so I think that's it for the abdomen assessment. And so next we're gonna do a kidney assessment to check for kidney stones. And so I'm gonna have Bree sit up for that. Sorry, Bree. And so yeah, turn this way. So let me know if you feel any pain. So I'm gonna cup my hand and then tap. Any pain, Bree? Nope. Nope. All right. Now once again, any pain? No pain. Nope. Alrighty. So Bree does not have any pain, which indicates that she does not have any kidney stones. And so with that completes our thorax and abdomen assessment of Bree.